Good morning, guys. Okay, we're going to start in chapter 8. So 8 is going to start on page 235. The gynecologic examination and prenatal care. Introduction to the gynecologic examination and prenatal care. The medical assistant should have knowledge of the gynecology and obstetrics to assist in examination and treatments in these specialties. Gynecologic examinations are frequently and routinely performed in the medical office. Prenatal care consists of a series of scheduled medical office visits for the promotion of the health of the mother and fetus during the pregnancy. Obtaining the patient's cooperation makes a gynecologic or prenatal examination proceed more smoothly and, as a result, makes the patient feel more comfortable. The medical assistant can help by explaining the purpose of the procedure to the patient. If the patient understands the beneficial result to be delivered from the examination, she is more likely to participate as required. This chapter discussed the gynecologic examination and prenatal care and the procedures involved in both. For the examination, gynecology is the branch of the medicine that deals with the diseases of the reproductive organs of women. That needs to be highlighted. The gynecologic examination is frequently and routinely performed in the medical office and generally includes a breast examination and a pelvic examination. That needs to be highlighted as well. The purpose of the gynecologic examination is to assess the health of the female reproductive organs to detect early signs of disease, leading to early diagnosis and treatment. That needs to be highlighted. The examination may be part of a general physical examination or it may be performed by itself. Although assisting with the gynecologic examination is a routine procedure for the medical assistant, the patient may not consider it a routine examination. To reduce apprehension or embarrassment, the medical assistant should fully explain the procedure to the patient and offer to answer any questions. If you look down for the terms related to gynecology, you do need to become familiar with all of these, but I do want you to highlight the first, fourth, and eighth terms. If we go on over to the breast examination part on page 236, the provider usually begins the gynecologic examination with the breast examination. The medical assistant is responsible for assisting the patient into a supine position. That needs to be highlighted. If we go on down to the second paragraph, the patient should know how to examine her breast at home for the presence of lumps and other changes with the breast self-examination, BSE. That needs to be highlighted. Most breast cancers are first discovered by women themselves. The American College of Obstetricians and Gynecologists recommend that women 20 years of age and older examine their breast once every month. That needs to be highlighted. If we go on over to page 238, the purpose of the pelvic examination is to assess the size, shape, and location of the reproductive organs and to detect the presence of disease. The pelvic examination consists of the following components: inspection of the external genitalia, vagina, and cervix, collection of the specimen for a pap test, bimanual pelvic examination, and rectal examination. That needs to be highlighted. For the pelvic examination, the patient is positioned in the lithotomy position. That needs to be highlighted. If we go on down to the third paragraph on page 238, please highlight the medical assistant can help the patient relax during the examination by telling her to breathe deeply, slowly, and evenly through the mouth. If the patient is relaxed, it is easier for the provider to insert the vaginal speculum and to perform a bimanual pelvic examination. It is also more comfortable for the patient. If we go on over to the other side of page 238, where the inspection of external genitalia, vagina, and cervix, in the second paragraph, if you will highlight the very last sentence, the function of the speculum is to hold the walls of the vagina apart to allow visual inspection of the vagina and cervix. That needs to be highlighted. If we go on down to where it says pap test, a pap test is usually part of the pelvic examination. It is a simple and painless cytology evaluation named after its developer. It is used for the early detection of cervical cancer. That needs to be highlighted. If we go on over to the other side of page 239, please highlight the sentence where it says almost all cervical cancers are caused by the human papillomavirus HPV. That needs to be highlighted. Now let's go on over to page 240. If we go under the patient instructions, please highlight the following. The patient should be instructed to schedule her Pap test 10 to 20 days after the first day of her last menstrual period. This is because it is recommended that the Pap test not be collected during the patient's menstrual period. The patient should be told not to douche or insert tampons, vaginal medications, lubricants, or contraceptive spermicides into the vagina for 2 days before having a Pap test. Douching and tampon insertion reduce the number of cells available for analysis, and the vaginal medications and spermicides change the pH of the vagina. That needs to be highlighted as well. We're going to go on down to cervical specimen. Please highlight where it says the provider obtains the cervical specimen by placing the S-shaped end of the plastic spatula. If you look on to page 241, please read over the figure 8.3. And then if we look under where it says the direct smear, with the direct smear method, a thin smear of each specimen is spread onto a glass slide that has a frosted edge. The medical assistant must label each slide on its frosted edge with a lead pencil according to the source of the specimen as follows: V for vagina, C for cervical, or E for endocervical. That needs to be highlighted. You also need to be aware where it says a liquid-based preparation. The most commonly used method to prepare the Pap specimen for evaluation is the liquid-based preparation method. Brand names include Thin Prep and Sure Pap. Please highlight that. Now we're going to go on over to page 242. We're going to be looking at the paragraph right before the cytology request. The preservative maintains the specimen and prevents it from dying out and during transport to the laboratory. After it is received by the laboratory, the vial is placed in an automated slide preparation processor. The automated processor performs several important functions. Please highlight this. First, it separates the cells from debris present in the specimen, and then it disperses a representative cell sample onto a slide in a thin, uniform layer. If you look on to page 243, that form is a GYN cytology requisition. If we go on over to page 244, you see the GYN cytology report. We are going to go under the maturation index. Please highlight where it says the maturation index provides the provider with an endocrine evaluation of the patient. That needs to be highlighted. I also want you to highlight under the cytology report the TBS. Now if we go on over to page 245, I do want you guys to read over the table 8.1. And then I also want you to highlight where it says the National Cancer Institute of Bethesda, Maryland developed a system. It provides a detailed cytologic description rather than a numerical result. That needs to be highlighted. Now we're going to go on over to page 246. I want you to highlight the very last sentence above rectal vaginal examination. Between the two hands, the provider can palpate the size, shape, and position of the uterus and ovaries and can detect tenderness or lumps. Again, make sure you highlight that. For the rectal vaginal examination, please highlight where it says the provider inserts one gloved finger into the vagina and another gloved finger into the rectum to obtain information about the tone and alignment of the pelvic organs and the adnexal region, which consists of the ovaries, fallopian tubes, and ligaments of the uterus. If you will also highlight where it says this is typically performed on women beginning at 40 years of age. Now, if you all will also look over procedure 8.1 on page 246, 247, 248, and 249. That is the breast self-examination instructions and assisting with the gynecologic examination on page 249. I do want you to highlight all of number 7 on page 249, the procedure step, including A and B. On page 250, if you will highlight the procedural step number 14. And then if we go on over to page 252, where it talks about the vaginal infections. We are going to start with the trichomoniasis, which is a pear-shaped protozoan with 4 flagella that allow for the motility of the organism. Symptoms of the infection include a profuse, frothy vaginal discharge that is usually yellowish green and has an unpleasant odor, itching and irritation of the vulva and vagina, dyspareunia, and dysuria. That needs to be highlighted. If we go on over to page 253, please also continue to highlight where it says the trichomonas may be identified at the medical office by a wet preparation, which involves placing a small amount of the discharge on a microscope slide using a sterile swab, adding a drop of isotonic saline to it, and placing a cover slip over the mixture to protect it. Please make sure you highlight that. And if you look on figure 8.9, that is how that's the steps and what it looks like when doing a wet preparation. On the other side of page 253, if you will highlight the first sentence before the candidiasis, where it says that the trichomoniasis is treated with the oral administration of metronidazole, also known as Flagyl. Now we're going to start where it says the candidiasis. Candida albicans is a yeast-like function normally found in the intestinal tract and is frequent contaminant of the vagina. That needs to be highlighted. I also want you to highlight where it says conditions such as pregnancy, diabetes mellitus, and prolonged antibiotic therapy produce changes in the vagina that may precipitate a candidal infection of the vagina, commonly referred to as a yeast infection. Symptoms of the candidiasis include white patches of the mucous membrane of the vagina, a thick, odorless, cottage cheese-like discharge. Again, all that needs to be highlighted. In the very next paragraph, please highlight where it says the KOH dissolves cellular debris present in the smear and allows better visualization of the yeast buds, spores, or hyphae. On page 254, I also want you to highlight where it says in the very first paragraph above chlamydia, oral administration of fluconazole, also known as diflucan. Please highlight that. Now we're going to go on down to chlamydia. Please highlight that chlamydia is caused by the bacterium Chlamydia trachomonas. Trachomonas. Sorry, some of these terms are so hard for me to pronunciate. Highlight continually where it says it is a gram-negative intracellular bacterium that grows and multiplies in the cytoplasm of the host cell. Chlamydia is the most frequently reported and fastest spreading sexually transmitted infection in the United States, particularly among adolescent girls and young women. In the very next paragraph, please highlight where it says if symptoms do occur, they may include one or the more of the following: dysuria, itching and irritation of the genital area, and a yellowish, odorless vaginal discharge. The symptoms usually appear 1 to 3 weeks after the patient has been infected. If not treated, chlamydia can spread further into the female reproductive tract and cause pelvic inflammatory disease, also known as PID. If we go on down to the very next paragraph, for men are more likely to have symptoms than women. However, the symptoms may appear only early in the day and be so mild they are ignored. If the infection is not treated, it can cause epididymitis, a painful condition of the testicles that can result in infertility. Now we're going to go on over to gonorrhea. Please highlight where it says gonorrhea is an infection of the genital urinary tract that is transmitted through sexual intercourse. Chlamydia often occurs in association with gonorrhea. Approximately 25 to 40% of patients infected with gonorrhea also have chlamydia. If you go on down to the third paragraph, you need to also highlight where it says, if not treated, gonorrhea may cause epididymitis, which can lead to infertility. 2 more paragraphs down, you need to also highlight where it says the medical office most frequently uses a DNA probe test or a nucleic amplification test, NAAT, to diagnose gonorrhea. Now we're going to go on over to where it says obstetrics and prenatal care. You need to highlight on page 254 where it says prenatal care consists of a series of scheduled medical office visits for promotion of the health of the mother and fetus through prevention of disease and early detection, diagnosis, and treatment of problems common to pregnancy, for example, anemia, urinary tract infection, and preeclampsia. Early detection of medical problems helps prevent serious complications in the mother and the fetus. That needs to be highlighted. You do need to become familiar with the obstetric terminology. And you also need to become familiar with the prenatal visits 1, 2, and 3. The first prenatal visit generally occurs after the woman has missed her second menstrual period. That needs to be highlighted. The very next paragraph, you need to highlight the components of the first prenatal visit vary depending on the medical office, but they generally include the following: completion of a prenatal record form, initial prenatal examination consisting of a complete physical examination. Of particular importance are breast, abdominal, and pelvic examination. Pelvic measurements may be taken at this time or during a return prenatal visit. Prenatal patient education and laboratory tests. Again, all of that needs to be highlighted. For the prenatal record provides information regarding the past and present health of the patient and serves as a database and flow sheet for subsequent prenatal visits. The prenatal record is essential in helping identify high-risk patients. And if you look on page 258 and 259, that is what a prenatal health history form looks like. If we go on over to page 259 on past medical history, please highlight where it says the past medical history focuses on conditions that could affect the health of the mother and fetus, such as diabetes, hypertension, heart disease, autoimmune disorders, kidney disease, liver disease, varicosities or phlebitis, alcohol and tobacco intake and drug addiction, RH sensitization, pulmonary disease, for example, tuberculosis, asthma, bleeding tendencies, surgeries, anesthetic complications, previous abnormal Pap test, infertility problems, sexually transmitted infection, and drug allergies. On page 260, if we do the menstrual history, please highlight where it says it includes the date of onset of menstruation, the menstrual interval cycle, the duration of the amount of flow, documented as small, medium, or large. That needs to be highlighted. You also need to become familiar and highlight all the obstetric history, such as number 1, 2, 3, and 4. All that needs to be highlighted and reviewed. If we go on over to page 262, the present pregnancy history, please highlight where it says the present pregnancy history establishes a baseline for the present health status of the prenatal patient. In addition, the patient is queried regarding any warning signs that may be present and that may place the mother or fetus in jeopardy, such as persistent headaches, visual disturbances, abdominal pain, vaginal bleeding, or discharge. The patient also is asked whether she has experienced any of the early signs of pregnancy, such as nausea, vomiting, fatigue, and breast changes. All prescribed over-the-counter medications, including vitamin supplements and herbal products the patient is taking, must be documented. All of that needs to be highlighted. If you're going over to the other side on page 262, we look at the last menstrual period. It's used to calculate the due date or expected date of delivery, the EDD. I do want you guys to look at the formula for the EDD equals LMP minus 3 months plus 7 days plus 1 year. If you view that diagram, you'll be able to kind of calculate how they come up with the estimated delivery date. Now let's go on over to page 263, the interval prenatal history. The interval prenatal history also is included in the prenatal record form. Its purpose is to update the record. During every return visit, essential data including weight, blood pressure, urine testing results, fundal height measurement, and fetal heart rate are collected and documented in this section. A general inquiry is made regarding the occurrence of additional signs of pregnancy, such as fetal movement or Braxton Hicks contractions, and how the patient is feeling and any concerns or symptoms since the last prenatal visit. All of that needs to be highlighted. Now we're going to go on over to page 264. I do want you to also review table 8.2. Highlight and read, especially for the vital signs, physical examination, breast examination, and pelvic examination. And then where it says the warning signs during pregnancy, please review that. And then if we go on down to page 265 where it says chlamydia and gonorrhea, please highlight the following where it says if a gonorrheal infection is present at the time of delivery, the N-gonorrheal organism could infect the infant's eyes during passage through the birth canal. This may result in the ophthalmia neonatorum, which if not treated, could lead to blindness. If we go on down to the group B, streptococcus, the very last sentence on the first paragraph and the first sentence on the second paragraph need to be highlighted. When infected, the infant may develop an infection of the blood, pneumonia, or meningitis. To prevent GPS infection of the newborn, a pregnant woman is tested for the bacteria between 35 to 37 weeks of gestation. Now we're going to go on over to page 268. I do want you to highlight where it says 0 to 28 weeks of gestation every 4 weeks. And if we go on down to the second paragraph where it says the patient is asked to provide a urine specimen during each return prenatal visit. The medical assistant is responsible for testing the specimen for glucose and protein using a reagent strip and for documenting results in the prenatal record. That needs to be highlighted. You also, if you go down a little further, please highlight where it says hypertension is the most common medical disorder of pregnancy and occurs in 10 to 12% of all pregnancies. Now we're going to go on over to page 269. I want you to highlight the second paragraph where it says, in addition to assessing the duration of the pregnancy, the fundal height measurements permit variations from normal to become apparent and are used to assess whether fetal growth is progressing normally. Highlight fetal heart tones. The normal fetal heart rate is between 120 and 160 beats per minute with a regular rhythm. I also want you to highlight on the other side on page 269 where it says the fetal heart tones can be heard with a Doppler fetal pulse dictator between 10 to 12 weeks of gestation. Now we're going to go on over to page 270 for the vaginal examination. I do want you to highlight where it says the vaginal examination is usually begun approximately 2 to 3 weeks from the EDD and is performed to confirm the presenting part and determine the degree, if any, of cervical dilation and effacement. That needs to be highlighted. You also need to become familiar with the multiple marker test. I do want you to highlight where it says the multiple marker test is a laboratory test available to pregnant women between 15 and 20 weeks of gestation. Its purpose is to screen for the presence of certain fetal abnormalities, which include neural tube defects. If we go on over to page 271 for the obstetric ultrasound scan, please highlight where it says the sentence, the primary purpose of an ultrasound scan is to evaluate the health of the fetus and determine the gestation age. You do need to also highlight under the transabdominal ultrasound. This is accomplished by instructing the patient to consume 32 ounces of fluid approximately 1 hour before the procedure. That needs to be highlighted. Now we're going to go on down to the amniocentesis. Amniocentesis is a diagnostic procedure that can be performed between 15 and 18 weeks of gestation. Amniocentesis aids in the prenatal diagnosis of certain genetically transmitted errors of metabolism, congenital abnormalities, and chromosomal disorders such as Down syndrome. It is also used to detect fetal jeopardy or distress and later in the pregnancy to assess fetal lung maturity. Amniocentesis also can determine whether the fetus is a boy or a girl. That needs to be highlighted. Now on page 272, box 8.3, please come read over and highlight where for the between 7 to 12 weeks and the between 18 to 20 weeks, and make sure that you review that. If we go on over to page 273 under the fetal heart monitoring, a fetal heart rate FHR monitoring is performed later in the pregnancy to obtain information on the physical condition of the fetus. Specific conditions that may warrant this procedure are fetal growth that is not progressing well, decreased amniotic fluid, decreased fetal activity, elevation of the mother's blood pressure, gestational diabetes, and an overdue infant. That needs to be highlighted. All right, and then now we're going to go on over to page 277, 6 weeks postpartum visit. The per PM includes the period of time which the body systems are returning to their pre-pregnant or nearly pre-pregnant state, which usually is 4 to 6 weeks after delivery. That needs to be highlighted. You also need to go down the second paragraph. Please highlight where it says by 10 days postpartum, the flow should decrease and the lochia should become yellowish white. This is known as the lochia alba. That needs to be highlighted. If we go on over to the other side of page 271, the very first paragraph, highlight where it says the patient should be instructed to contact the medical office under the following circumstances. If the amount of discharge increases rather than decreases, if the discharge is absent within the first 2 weeks after delivery, if it changes to red after having been yellowish white, which indicates bleeding, or if it takes on a foul odor, which indicates infection. That needs to be highlighted. On page 278, please read over and become familiar with table 8.3. Also, in particular, the vital signs, breast examination, pelvic examination, and the rectal vaginal examination. All right, guys, that includes chapter 8. Again, make sure that you are reading over all of the chapters. And I'm just going to continue kind of going over the bits and pieces. If you have any questions about anything, don't hesitate to reach on out to me.